Hi, Mom and Dad. I'm gonna be your baby's nurse for today. I am coming in here to check on baby and to make sure baby is okay. And I'm going to do something called a newborn assessment. Are you guys feeling okay? If you have any questions? Okay. So first I am going to, just take a look, see, and nothing that harms baby. If you guys have any questions along the way, then feel free to ask me. I am here to support you guys. Okay. All right. Baby's in the bassinet. Is baby safe? Baby looks safe. Baby has no extra pillows or blankets. Remember that baby's still new, so baby is not allowed to have any bumpers, toys, pillows, stuffed animals, things of that nature, because that increases the risk for SIDS and suffocation and other things. Mom, can we do a verification of baby's wristband and yours? Okay. 92678. 92678. Okay, good job. Baby's a match. Um, so, like I said earlier, we're going to do a very brief assessment on the baby because I don't want to bother the baby in any way or irritate them. Baby seems to be normal. She's quiet. She's quiet and alert. Okay. Pupils normal. Quiet and alert. So that's a good thing. She's looking around. She's just observing her environment, which is really, really good. She's not crying, but I know that she has before. Has she had any issues crying? Okay, no good. Okay. So yes, just to inform you guys, just because baby is crying does not necessarily mean that it's in pain. You know, that is one of the ways that babies use to communicate with us. So sometimes there is other issues, but baby isn't able to communicate in the way that we are. No pain. Baby seems okay. Before the procedure, I wash my hands, put my gloves on to make sure that I'm keeping a clean environment for baby. Was baby bathed today? Okay, great. Looks good, clean. Everything looks great. I love the baby wash that they use. It smells so good. It really does. I use it on my kids too. So I'm gonna take a listen to baby. This doesn't hurt, so I'm going to definitely take a listen and take a listen to baby. Okay, baby's heart rate is really healthy, and babies usually have a higher heart rate. So hold on one second. Okay, lungs sound clear. No signs of crackles or fluid. Check the other lung. I'm gonna support the baby with my other hand. Yes, clear. Lungs sound clear and free of fluid. No crackles. Okay, respiratory. Baby's heart rate is 112, which is normal. Babies always tend to have higher heart rates, and that is beginning in the womb, so I don't want you to be alarmed. Babies just always tend to have a higher heart rate than regular, than adults and older children. Hmm. Okay. Right now, baby has a respiratory rate of 30 breaths per minute, which is normal. The vital signs tend to be elevated as a newborn because baby is still getting used to the environment that he or she is in. Let me see. Going to take a listen to baby's bowels. Um, okay. Baby has some bowel sounds. And baby has some good bowel sounds. Everything sounds normal. Now now that I'm done listening to baby, I'm going to palpate and do some physical examinations of the head and other things like that. Okay, so we're gonna take off baby's hat. Okay. Okay, and the sutures are normal. I feel the sagittal suture, the coronal suture, and these are normal. The corneal sutures, excuse me. These are normal to feel, since baby is a newborn, and his or her head is still forming. Now I'm going to take a look into baby's eyes. Okay. All right. Looks normal. Pupils are great. They're reactive. They're reactive. Good job, baby. Do we have a name for baby yet? Ari? That's pretty. Ari Marie? I like that. That's very pretty. You guys did a great job on her name. Hi, Ari. Okay, let's see if the ears line up with the eyes. The eyes and ears are perfectly aligned. I am doing my homework, ladies. Um, okay. Okay, what I'm going to do is check. What I'm gonna do is check baby's nose to see if baby is able to breathe with one nostril being blocked off for the next. So I'm gonna do the left side. Okay, baby sounds perfect. Baby sounds perfect. Okay, so basically what I just did was to basically isolate one side to see if baby can still breathe or have trouble, or if baby has trouble breathing with the nostrils being blocked. Babies are obligate nose breathers, so they mostly breathe through their nose. So just to see if baby does have trouble breathing if the nose was blocked. Let me see. I'm going to stick my finger in baby's mouth to see if baby has cleft palate or cleft lip. And I'm also going to see if baby has a good sucking reflex. Baby has an amazing sucking reflex. It looks like Ari is hungry. So after I'm done the assessment, Mom, if you want to put her on the breast, you can. Rooting reflexes, when baby turns towards you. Baby did a little bit of that as I was touching her, so that's a good thing. Let me check your baby's neck for webbing. Baby's neck looks completely normal. No webbing. And since baby was bathed, I don't see any vernix. The white kind of cheesy stuff that comes out when baby's born. Chest looks evenly colored and proportionate. Doesn't look any spots of concern. Baby's skin looks even toned. One second. All right, so Baby is in the flex position currently, which is what both babies are in because it simulates the fetal position. And you know, baby's still getting used to being on the outside. Except for now, the baby is going to flex her arms and arms look normal. Arms look beautiful. We love the flex position. Baby is in the flex position. And the fetal position was the position that they were in the womb. So they kind of favor towards that position until they get a little older. Baby has great muscle tone. Let me see. Baby has 1, 2, 3, 4, 5 fingers on each hand, and 5 fingers on 5 feet, 5 toes on each foot. Excuse me. I'm gonna learn how to talk today. Okay. Let's see. Baby has palmar grasp. Amazing. Baby is doing great. Check the legs and toes. Everything looks great. Everything is great. Plantar grasp. Okay. Let me see. Let's see the plantar grasp so I can. Excuse me. Okay, Palmer plantar grasp is amazing. Baby is doing great. Okay. Okay, baby's plantar Levinsky sign is okay. The legs are the same length. They are symmetrical. We're gonna check the genital area. Okay, so baby's genital area is normal looking. It's some slight slight swelling due to baby's age, and this is a girl. But you know, mom and dad, you knew that because you got the ultrasound. There is no white, no smegma, which is like cheese in the genital area, basically the cheese-like substance. There's no smegma present because your baby got a bath. There is no pseudo menstruation. Sometimes when baby girls are born, they can take over their mom's hormones or take some over to their body, and they can have slight bleeding. Ari does not have that, so yeah. Um, okay. When baby first uses the bathroom, first has his first stool, it's going to be black and tarry. It's called meconium, and that's usually baby's first stool. Baby's first stool is usually, you know, little, yeah, just a little black. And once you, it's going to be like a few changes after that. Then it'll go to like a yellowish green, soft consistency. Um, cord, since you guys cut the cord and everything, the cord is going to be thick at first and shiny at first. You have to let it fall off. You can tuck it in the diaper after you clean it. Tuck it in the diaper. You got. I'm sorry. You have to tuck under the umbilical cord so that it won't have a risk of falling off or getting sheared or Do not pull it off. It'll fall off by itself. Um, I am going to. I'm going to check baby. Okay, so sorry about that, Mom and Dad. I'm going to turn baby around and hold her like this and check the back for Mongolian spots. Looks to me like she does have a little bit of a Mongolian spot, which is completely normal. And the bottom looks fine. No signs of sacral dimples. And last but not least, we're going to do baby's temp. Let me get my supplies, and I should be back in a second.
Vitamins, if you can tell me now. Yeah, plenty. Disinfect the mask. You're going to want to use baby powder in the soup, heavy on the joints. You don't want any chafing, right? No, that was everything. Look up what alcohol is. I just take my body. Swing on the way there.
Okay, so Mom and Dad, I'm going to take baby's temperature under the arm. We used to do rectals, but you know that's a little dangerous for baby, and I wouldn't suggest that because you could perforate the baby's rectum and you can go too far and hurt something. We don't want that. Okay, baby's temp is 98.6, which looks beautiful. So all in all, baby looks great. I'm going to wrap baby back up and put baby back in a sleeping position. I understand that babies don't like the thermometer. It's uncomfortable for them, so I try to save that one for last. But besides that, baby's doing great, and you guys, congratulations to the both of you. And if you guys have any questions or concerns, please call me. My name is Christina. Again, I'll be your baby's nurse for the night. Thank you guys for seeing me, and I'm going to step out, okay?